When my daughter was first diagnosed with autism, it felt like my world was turned upside down. ABA was recommended, but I didn't even know what it was. I had a list of providers, but wasn't even sure where to begin. As a BCBA with over 20 years of experience, I've helped countless families navigate this same journey, and I understand exactly how overwhelming it can be. So in this video, I'll walk you through 5 essential things to look for in a quality ABA program so that your child can get the best start possible on their journey. Let's get started. So, what is ABA? ABA stands for Applied Behavior Analysis. It's a therapy that uses a behavioral approach to teach a variety of skills, such as communication skills, social skills and play skills, daily living skills, and it also helps reduce challenging behaviors. ABA focuses on taking a skill and breaking it down into smaller bite-sized steps that your child can achieve while it's being paired with positive reinforcement. Additionally, for challenging behavior, positive reinforcement is used to really focus on reinforcing those positive, desirable behaviors we want to see, all while decreasing those challenging behaviors. Simply put, ABA is a very effective therapy, so it's crucial that it's done right. That's why choosing the right program matters. It's essential that the ABA therapy that your child receives is tailored to their specific needs, and that the program you choose follows evidence-based practices. The right program can make a huge difference in your child's progress. Now, there are a few factors to consider first. Whether you were provided with a list of providers or guided to just get ABA for your child, you'll need to figure out which type of provider you're most comfortable with. You'll typically see for ABA agencies, you have what I call the big box agencies. These are ABA clinics or agencies that are across multiple states, or they may have multiple locations within a state. And then you also have your smaller, either BCBA owned, family owned, or some type of related service provider owned agency. So some like the feel of the bigger multi-state type of operation, or some would prefer the smaller one. Now, looking at the pros and cons of both, for the larger multi-state, multi-location agencies, they are usually backed by private equity. So there's more money, they can put more money into some of the services and some of the things that they have within that clinic or agency. However, sometimes there may be high turnover at these agencies. This may also happen with the smaller BCBA owned ones as well. For me personally, I always like to go to the website of the agency or clinic I'm interested in and just read the About Us section. I'd like to kind of have an idea who's in charge, who's overseeing it, what the structure is. And I would really suggest that you do that as well. So when you have some of these providers, check out their About Us section. See if there's a person that they list as the director, clinical director, or just what approach they use, anything about their specific agency. So another thing you need to think about is in-home ABA versus clinic-based ABA. Now, there are pros and cons to both, and it really is a personal choice on what's best for your child and your family. Now, some pros for in-home ABA are that your child can work on those skills in the natural environment, the environment that they're in the most. For the pros for a clinic-based setting, there you have peers at the ready to work on social skills. It also provides a structured environment to kind of get your child ready for a more school-based environment. So you have those pros. Now on the cons, for the in-home, sometimes there's just too many distractions going on. Not everyone has separate space for their child to be able to work with their technician on their different skills. And so you have other siblings there, you have extended family there. And so there might be a lot of distractions and someone's cooking a meal and they're trying to work. There's that piece of it. For the clinic-based setting, there you have limited opportunities for the family to address certain behaviors or to observe sessions so they can learn possible skills. Now, That can be rectified by having regular parent training meetings, and you can always request to sit in on your child's session even in a clinic-based setting. Additionally, another con for the home-based setting is that an adult has to be present at all times when therapy is going on in the home. Now, on the reverse of that, for a clinic-based, also, it may be a challenge for families to be able to take their child and the travel involved to get to the clinic on a daily basis. So you have those two different things to think about. And ultimately, it really is a personal decision, and you need to do what feels right. So now let's take a look at the 5 key components of a quality ABA program. First and foremost, you want to ensure that your child is working with qualified and experienced professionals. The team should include, first off, a Board Certified Behavior Analyst, or BCBA. You may also see BCBA-D, and that stands for Board Certified Behavior Analyst at the doctoral level. And so they are responsible for your child's programming. And they also will oversee staff who are working with your child. They make the decisions on when there's either little progress and a change has to be made, or if there's ongoing progress, the new goals that have to be put in place. Now, the staff that they oversee are behavior technicians. You'll also hear RBTs as well. That's for Registered Behavior Technician. These are the people who will be working directly with your child. When it comes to RBTs, that Registered Behavior Technician, that means they have a certification. They are required to complete a 40-hour course, and then they are assessed by a BCBA. After that, they sit down for an exam, a certification exam, and if they pass it, they get the RBT credential. Then they're required to get ongoing supervision from a BCBA. Now, I want to be clear, just so you know, there are BTs or behavior technicians who don't have that certification, but may have been in the field for many years. And then there are those with the RBT certification who are brand new to the field and don't have any experience at all. So, it would be great that those who have been in the field for a long time get that RBT certification, but I just want you to be aware that that shouldn't be the only thing you look at when it comes to whether this person is qualified or not to do ABA with your child. Now, that said, I think the biggest thing you want to find out about is their training. To find out from the agency you're with, what's their training look like? How do they train? Not just when staff start with them, but ongoing training, because that's really important, as well as the level of supervision that the staff receives on a regular basis. One other thing I want to mention, that for the BCBA who oversees your child's programming, if there is licensure for ABA in your state, you want to make sure that your BCBA is also licensed. You'll see at the end of their name, the initials besides BCBA, you may see either LBA, LABA, or something similar to that, depending on your state. So to find out if your state does require licensure for ABA providers, I've included down below in the description a link so you can find out. So now you have your ABA provider, so what's next? So let's look at assessment and intensity of treatment. So a good ABA program will conduct a thorough assessment of your child's needs, their strengths, and their areas of growth. Now, in ABA, there are certain assessments that we use fairly frequently, and these include the VB MAP, which stands for Verbal Behavior Milestones Assessment and Placement Programs. There's the ABLES-R, that stands for the Assessment of Basic Language and Learning Skills Revised. There's the Vineland and their Behavior Adaptive Scales, that's a questionnaire. The PDD-BI, which stands for Pervasive Developmental Disorder Behavior Inventory. And yes, I'm cheating because I can't remember all that in my head. There are also other developmental assessments that your BCBA may choose to use to get a better picture of your child as well, or a fuller picture. I'll also leave a list of these assessments down below in the description so you have them. This initial assessment will guide the creation of an individualized set of goals and behaviors targeted specifically to your child, and this is known as a treatment plan. Your treatment plan should also include parent training goals that basically will target training you to help you best support your child. Additionally, the BCBA overseeing your child's programming will recommend a certain level of treatment or intensity. And so this is really the number of hours your child will receive of direct ABA therapy, supervision, and the number of parent training hours. Once the treatment plan is put together, it will be reviewed by you, and then it is sent to your insurer for approval. And so typical ABA authorizations are for a 6-month period. Sometimes there are exceptions. Sometimes it may be a 12-month period. Sometimes it's less than 6 months, but fairly typically there will be authorization for that level of treatment for a 6-month period of time. Now, at the end of the first 6-month period, progress and data collected during that time frame will be written into the treatment plan report, and that will now be sent again to your insurer to be approved for the next 6 months. So one thing you want to look out for is that it does include changes to the level of services, the intensity. If a child's doing really, really well, and especially if they've been in treatment for a while, there may be a decrease in the number of hours. It should always be individualized to your child. And so, but this process continues every 6 months. Now, one thing I want you to be aware of, and I've seen this done or I've heard about this being done, and I know as a parent I would not appreciate this, and that is sometimes you find an agency, an ABA agency, like, okay, we'll assess your child, this is great, they assess, they send it off to the insurance company, they get approval for a set number of hours, but at that point they don't have any providers, and then they put you on a waiting list. I don't like this practice because basically the clinic or the agency is able to bill for that assessment they did for your child, but then you sit and do nothing. And I feel it's kind of false advertising because you think, okay, great, we're starting the process, we're getting assessed, we're ready to go, but now we're on a wait list. Or let's say your child gets approved for 20 hours a week and they only have someone who can provide 6. So, but sometimes as a parent, you're desperate, you're like, I'll take whatever I can get. I really don't like that practice. So if they say they can take your child and they can start the assessment, find out if they have the staff available, because once you get approval after the assessment's over, you want to make sure your child can hit the ground running and get the services that they need. A comprehensive treatment plan that is constantly updated based on the data is crucial. Data collection is how we track progress as well as know when to adjust programming. Now, if you are not seeing data being collected, it's not ABA. That's how it is. There should always be data collected, and it may take different forms, particularly these days. There are many clinics who are using online systems, so you'll see people with their phones or their iPads tracking things that way, and typically you will have access through a parent portal to your child's data so you can see it, typically in graph form, so it's easy to read. For those who still use paper and pencil, there's some of us out there who still do, it will be graphed on paper in program books. And so it's just a matter of reaching out to your BCBA if you want to see specific data, if you don't have access through an online portal. Positive reinforcement is at the heart of ABA. It's important that the program focus on reinforcing positive behavior and encourage generalization, meaning your child can apply the skills they've learned in one place across other settings. Now, children come to us not because they're great at things, but because things are hard for them. And so imagine if you had to do something on a daily basis. Let's say you were fearful of public speaking, but you had a public speaking class and you had to go every single day and be put in that position to be uncomfortable and anxious and whatever it may be. You'd try to avoid that class. So for our kids, it's similar, like to go to a place or to have someone come in to work with you on all the things that are hard for you can be really challenging. That's why it's imperative that there be lots of positive reinforcement. You want to find a good program where they use lots of positive reinforcement, that they break down goals into smaller digestible pieces so that your child can achieve these small goals and be successful and then feel more positively reinforced and then gradually increase that demand and build upon that. That's so important, and that's what you want to look for, that level of positive reinforcement. It can be in the form of verbal praise, or you may see kids will access a toy or a game that they like. For some of our early learners, you may see people use food, when they're not so much interested in toys or reinforced by verbal praise, a lot of times you may see some food being used initially as a reinforcer. You do want to see that faded out sooner than later, because you want them to be dependent on that forever, but it sometimes is a starting point. And ultimately, you may see tokens are used, so that kind of delays that reinforcement. That shows that the child can work for 5 tokens or up to 10 tokens before accessing their reinforcement. Now, positive reinforcement is an important component of effective behavior management, which is essential to reducing problem behavior as well as teaching new skills. So the supervising BCBA should oversee all behavioral assessments, which also include direct observation when there are challenging behaviors that occur. Now, these direct observations may occur across environments and should happen potentially multiple times, so they have a good idea of what is going on. Based on that, the BCBA will try to determine the function of the behavior. Basically, why is this behavior occurring? And then based on that, we'll create a behavior plan with strategies to be implemented when that behavior occurs. Now, what's really important for you to know is that a behavior plan cannot be implemented, cannot be put in place unless you sign off on it. You have to agree to it. It should be reviewed with you so you understand it fully. Also, anyone who interacts with your child, whether it be extended family, all the team members of your ABA team, that they all understand it so there's consistency across everyone. And in that way, improvement in that challenging behavior should occur at a faster rate. ABA isn't just for your child, it's for the whole family. The best programs provide regular training and support for parents in order to ensure consistency across all environments, whether that be at home, school, or the community. Now, when your child masters goals within their ABA program, it's important that parents and other caregivers help generalize those skills outside of the therapy environment. And that's why parent training is so important. It's also required by insurance companies, and it is part of the treatment plan request every 6 months. Now, parent training comes in different forms. You may meet virtually with your BCBA at times. Also, there will be in person, in home, in clinic, and often out in the community where certain behaviors occur. Now, I know personally, I've kind of been everywhere. So I've done in-home, but I've been in-home at like 6:30 in the morning. That was tough to work on a morning routine that was problematic. I was kind of snuck into someone's home at 10 o'clock at night on a Saturday because that's when problem behaviors were occurring. So again, where that problem is, and where you need the support is where your BCBA should be with you to help provide that in situ training. So parent training is a great time to bring up any concerns you may have, but also you don't have to wait until those meetings occur. If something's coming up or you're having a behavior that you don't know what to do with, don't try and manage on your own. Reach out to your BCBA to get that support then. But of course, always take advantage of your parent training, and with everyone on the same page, you'll have better outcomes. Choosing a high-quality ABA program will help your child thrive and make the journey easier for your whole family. Trust me, I've been there. And knowing what to look for will help you feel confident in making the best decision for your child. Also, please make sure to check out my next video in which we'll take a look at what you can expect in an ABA session. If you found this video helpful, please like, subscribe, and share it with other parents who might need guidance. And if you have any questions about ABA or how to choose the right program, leave a comment below. I'd love to help. Thanks for watching, and remember, you're not alone on this journey as we parent autism together.